Together we achieve victory over heart failure.
I am Dr. Somashekar. Today we are delving into a silent epidemic, heart failure. In India, the majority of the patients grappling with heart failure are surprisingly young individuals. It is a common occurrence into witness young adults seeking medical assistance for heart failure. Unlike the Western countries where heart failure is predominantly a disease of the elderly. Now let us break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it is the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or the commonly called as EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, that is the ventricles, each time when it contracts. While a normal EF is around 50 to 70%, individuals with heart failure typically have an ejection fraction of 30% or lower. Secondly, why are so many Indians affected by heart failure? Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsens this epidemic. Moving on, what are the signs and symptoms of heart failure? Watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, and weakness. There is also loss of appetite or vomiting. How can we protect ourselves from this disease? Our hearts works incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustment to maintain the heart health, incorporating daily exercise into your routine, practicing stress management techniques, quitting alcohol, tobacco, and smoking. Lastly, what comes next after heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve the quality of life and longevity. Devices like biventricular pacemaker, implantable cardiovascular defibrillator, commonly known as ICD, heart wall repair or a replacement of the valves, and a last resort treatment option is a heart transplant. To conclude, the lifetime risk of heart failure, chronic heart failure, is 1 in 5 for both men and women. Remember, awareness and proactive measures are the key in combating this silent epidemic. Thank you.